Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I'm specialized in facial rejuvenation, minimal invasive procedures, and also I specialize in laser technology. I treat many skin lesions, gynecological lesion, or improving the gynecological area with laser. But today I'm going to talk about a very interesting thing, that there is scars. Here we have a scar. We are going to talk about this scar, that is a rise scar or superelevated lip scar, and what kind of treatment I perform. This patient went different centers and all propose a resection from here to here. This is my curriculum, and I can improve this superelevated or raised scar with laser. I have an erbium laser, lotus laser, that I shoot the scar and I flatten. I do not put anesthetic cream. I do not make local anesthesia. The high speed of the light of the laser produces nothing of pain, and just I shoot and stop until I remove or flatten all the scar. And also I have many lasers to launch in this area to remove all these nerves. Here we can see in a closer view. And here is the way that the laser acts. Just in one session I remove all the scar, and this is the patient talk. But
acabamos de hacer la sesión láser, vemos que prácticamente ya desapareció la cicatriz, y si es necesario se hace alguna otra. ¿Molestó?
No, la verdad que no.
These are the pre-post immediately result. No downtime, and it is necessary some day after the procedure I perform another procedure and I remove completely the scar